My name's Dr. Lillian Medhus. I'm a doctor of nursing practice. I'm a women's health nurse practitioner and a certified nurse midwife. In addition to being a women's healthcare provider, I also have endometriosis, as well as I have a history of thyroid cancer and some autoimmune disorders. So I come at this conversation from both the provider standpoint as well as having been the patient. Yeah, so I think I have a similar story to a lot of people. My cycle started when I was probably in fifth grade, but within a few years, I had extreme pain with periods, and it would make me, stay in bed all day. And I was using heating pads and lots of ibuprofen. And so a few years later, probably, my mom took me to an OBGYN and they put me on a birth control pill. And for years it worked really well for me, so that was fine and I was managing okay, and then went off of it for some time in college. And when I went to try it again because my symptoms were getting worse, I was having heavier cycles, longer cycles, lots of pain. The pill just wasn't really working the way that it did before, and I was having a lot of mood changes with it as well. And at the time, I was in nursing school, but as an undergrad nurse, didn't know really anything about endometriosis or anything like that. And so, honestly, just kind of just figured that I would have to figure it out myself, and went off of the pill on my own and kind of started trying to self manage after that.
What helped? Did anything that you found kind of help? Especially, you said you were trying to self-manage.
hmm Yeah, so probably for, 10 years, from the time I was in my early 20s till my early 30s. Throughout that time, I went to graduate school and then got my doctorate. And then, of course, through all of that, was learning more and more about women's health and endometriosis and what may be going on with my body. And so I relied heavily on ibuprofen and Tylenol, heat packs. TENS units were really beneficial for me. I use the OB. It's a heat and TENS combined device. Epsom salt baths. And then as things started to progress more in my late 20s and early 30s, especially with other health conditions kind of layered on top of it, I started to explore an anti-inflammatory diet, which seemed to help my autoimmune conditions, but didn't really seem to impact my cycles too much. But at that time, I just was kind of like, well, now I am a women's health provider and I see these patients with the same symptoms all the time. And I kind of know what the treatments are. And to be honest, I don't really want any of them. So I'm just going to kind of keep doing this on my own until it came to a head a couple of years ago where it just got to the point where I couldn't do that anymore.
That's so interesting. And I was actually going to ask you that question too, going off of birth control. How did you know that, okay, I don't really want to try another type of birth control? Did you have any other side effects? I know you said it lasted for a while, but did you feel that, it, you know, that you didn't want to go on another type?
Yeah, so before I had been on a combined estrogen progestin birth control pill, and for me it caused pretty significant and swift mood changes where I was having depressive symptoms that I had never had before in my life, and so that's why I chose to go off of it the second time. And then in the last few years, I see a lot of endometriosis, confirmed endometriosis patients in my clinic, and so we talk about what are the options, and there's progestin only options and then surgical options as well, of course. And so I kind of started opening my mind to the fact that maybe a progestin only option might be a good idea because it could potentially help to kind of shut down those endometriosis adhesions if they were there. I hadn't had surgery yet at that point, so I didn't know for sure, but I was fairly certain. Um, And then what happened was I started having some severe pelvic pain throughout the month that was not associated with my cycle. And it finally got to the point where I was like, okay, this is bad enough. I need to like actually go see another healthcare provider, not just to trust myself to deal with it myself. And lo and behold, I had a large endometrioma, and so that's what turned into a surgery for me. I had my left ovary removed, and I had endometriosis excised. And then at that point, I think for me, it was like, okay, I really do have endometriosis. I haven't just been thinking this pain was really bad. Something as a healthcare provider is you see patients, and I have so much compassion for them. And there's this thought of like, well, what I'm going through is not as bad as what they're going through. So maybe I don't need to be on medication, because it's not as bad as what they're experiencing. But then at that point, I did decide to go back on a progestin only pill. And to be honest, things are better than they've ever been. So I wish I would have done it a long time ago.
That's amazing. And to go back to your surgery, so did you have an excision surgery?
So I wanted to have an excision specialist. I had a consult scheduled with someone here in Dallas that is trained through the Mayo fellowship. However, because the endometrioma was growing quickly, and they were concerned that there could be malignant features, especially because I had a history of thyroid cancer, they referred me to a gynecologic oncologist. And so she's who did my surgery, and she did do some excision. Unfortunately, she doesn't do complete excision the way that the other provider would have. But my pain so far has been well controlled, so I'm thankful for that.
Wow, that's really interesting. To learn more about your thyroid cancer diagnosis, when were you diagnosed and what symptoms were you having for that?
Yeah, so when I was in my early 20s, I was diagnosed with Hashimoto's hypothyroidism. So that's an autoimmune version of hypothyroidism, where the body attacks the thyroid gland. And we don't know exactly why. There may be environmental factors. I also have a family history. So I'd been treated for Hashimoto's for quite some time. And then in 2021, I started having pretty severe, significant fatigue and body aches and joint pain. And so we're not really sure if that was a result of having thyroid cancer or if it was a result of having another autoimmune condition that started at the same time. But nonetheless, they did an exam, my primary care provider, and thought they felt a nodule, sent me for an ultrasound, and there were some nodules on my thyroid that were tested, and they were indeterminate. So I had my whole thyroid removed and then found out afterwards that it was in fact cancer. So I have been fortunate enough that I mean, I'm still on obviously high dose thyroid replacement because I don't have a thyroid anymore. But I did not have to do what a common treatment is called radioactive iodine. So they're like pills that you take that are basically radiation pills that kill off any remaining thyroid cells. My levels have been fine. My tumor markers have been trending down since my surgery, so I haven't had to do that, which I'm thankful for. So my decision to go into women's health was before all of this. I mean, at the time I had painful periods, but I didn't really think a lot of it back then. Um, I went into women's health, I went into nursing school planning to be a women's health NP. And that was really because I looked around and I wanted to see, okay, where can I make a difference? And where is there like a gap in our community or in global health? And women's health is an obvious place where there's just a lack of resources and research being done, and honestly, like quality, compassionate care being provided. So that's why I wanted to be a women's health NP. And then when I was in undergrad, I had a mentor, and she was also a nurse midwife. And so just seeing the way that she interacted with patients, and one thing that really stood out is she just had like a sense of humor and really connected like person to person with patients. And so that's why I pursued both midwifery and women's health.
That is so cool. Wow, that's amazing. Just kind of curious too, people have questions about how to find a midwife or benefits of a midwife, anything you can provide about that?
Yeah. So what a lot of people don't know is that midwives are very similar, but not the same as women's health nurse practitioners. So our scope of practice is very similar. I'm both, so it's a little different. But women's health nurse practitioners, for example, care for patients from puberty through past menopause. They are primary care providers. They provide gynecologic care. You may see them in various places: OB/GYN clinics, Urogyn clinics, infertility clinics. Reproductive healthcare clinics, etc. Midwives do much of the same work. However, they also attend deliveries. So they also provide full OB/GYN care, full scope care, as well as attending births. So if you want to see either one, the benefits are oftentimes visit times are longer because our reimbursement structure is different than with physicians or surgeons. So you often will get a longer visit, more education. There's a strong focus in nursing on educating patients and on shared decision making. So giving you all of your options, pros and cons, and then helping you to make a decision that's best for you. So a couple of ways that you could find a midwife or an NP. You could go through your insurance. So nurse midwives and nurse practitioners are covered by all major insurers. You could first just check your insurance and see if there's anyone in your area. You can also go to ACNM is the certification organization for midwives, or NPWH is for nurse practitioners and women's health, and both have lists of providers in your area.
My next question is kind of both for you as a patient, but also on the healthcare side. When it comes to self-advocating, I think a lot of times, especially for women patients with endo or other, other chronic illnesses as well, sometimes we're not always believed with our symptoms. Anything when it comes to being a self-advocate, really when in these discussions with healthcare providers.
Yeah, so I've been fortunate enough to not have that experience. And I recognize that I have a great privilege coming into this conversation in that space because I am a provider. And I think that the way that I speak to providers, it gives me a different perspective. So I come into appointments and generally ask for what I want, and they are happy to do those things for me. And most patients don't have that experience, and so that's part of why I'm really looking to start my own practice, because I don't want patients to have to come in with their guards up and feel like they have to fight for what they need and fight to get their point across, and so I think one thing, if you're able to, of course, not everyone can, but if you're able to, kind of look around and find a provider that you don't feel like you have to fight so hard for your needs to be met, first of all, because it's exhausting. It's a lot on your shoulders to feel like you have to do that all the time. Other things I think that are helpful for general women's health providers that maybe don't see a lot of endo are to track your symptoms so that you can come in and say, okay, here's for the past 6 months, here's where my cycles were, this is what my pain was, this is what I did for it, and this is kind of what the outcome was. Can be helpful for them to just kind of see that you know what's happening and you're aware of what's going on in your body. And then to keep good records for yourself too. So you can say, okay, for instance, I have a lot of patients that come in and say, well, I've already tried birth control, I don't want to try that, which is fair. And there's also hundreds of types of birth control. So we really need to know, what have you tried in the past? So keeping good records of, I was on, whatever, Yaz for 3 months and this happened. And then I was on Depo-Provera for 6 months and this happened, and so if you have those kind of records, that can also help in communicating your story to people.
Thank you for that. I think that's really important too, because I think that is sometimes what happens, right? Okay, well, let's just try birth control again.
Hmm.
And when there are so many symptoms, I think it can be a little triggering for some patients to say, well, I already did that. I'm nervous to try another one. So
Hmm.
thank you for that. Now just kind of as a last message, anything, words of advice or any other message or anything that I didn't ask you that you'd like to add.
Yeah, I'd just like to add that, as a women's health provider, and having been in the patient seat, um, in my perspective, one of the most difficult things about a chronic condition like endo, and many others is the constant management of all of your providers and kind of being the central cog in the wheel of like between your pelvic floor PT and your dietitian and your primary care provider and your gynecologist. And that takes a lot of emotional and physical taxing on yourself, to be able to manage all of that. And so, yeah, just give yourself a lot of grace and credit for all of the time and the emotional burden that is. And then, for me, I'm really seeking to start a practice where I can be that person, that care manager for patients, so you don't carry that burden all the time. So if you're able to, really seek out a provider that's going to help you to manage all of those pieces, rather than you having to carry it all yourself.